And this year at ASH, on behalf of my co-investigators, I presented an abstract entitled IO-202, a novel anti-LIL-RB4 antibody with azacitidine for hypomethylating agent-naive chronic myelomonocytic leukemia. We presented the results of the phase 1 expansion cohort results. And as most of the viewers know, CMML is a rare but potentially lethal hematologic malignancy affecting about 1,000 patients per year in the U.S. Although it's called a chronic leukemia, median survival is typically less than 3 years. Very few patients are able to proceed to curative hematopoietic stem cell transplant. And the standard of care is currently typically a hypomethylating agent alone, such as azacitidine, but the remission rates are only on the order of somewhere around 10 to 20%. And so really novel therapies for CMML are urgently needed. And so IO-202 is a naked monoclonal antibody against this protein LIL-RB4, or leukocyte immunoglobulin-like receptor B4, also referred to as LIL-RB4. And this protein is important because it's overexpressed in CMML cells relative to cells from healthy donors or from patients even with MDS. And so this is a first-in-class drug that depletes LIL-RB4 positive cells by ADCC and ADCP, and the FDA has designated this drug for fast track and orphan drug designation. So we presented for the first time the results of this expansion cohort. It was patients with CMML who required treatment and had not received a hypomethylating agent. They were enrolled regardless of the LIL-RB4 expression. Azacitidine was given as a standard dose. The IO-202 as a monoclonal antibody is given with a loading dose on day 1 and then every 2 weeks at a lower dose. And so we presented the safety data from 21 patients and the efficacy data from 18 patients using the IWG criteria to report efficacy. As far as the baseline characteristics, as you might expect for a cohort of CMML patients, this was an older cohort with a median age around 71. 2/3 of patients were men. The patients were pretty evenly split between dysplastic and proliferative CMML subtypes. Nearly 20% of patients had CMML2, with about half of patients having blast greater than 5%. Baseline symptom scores, as assessed by the MPN-SAF, were quite high, with almost 50% having a score greater than 15. And approximately half of patients were high risk by the CPSS molecular risk stratification system. So high risk cohort. The drug proved to be extremely safe. We saw very little additive myelosuppression. We did see some mild infusion-related reactions, typically on day 1 of therapy, but without subsequent recurrences. No patient required discontinuation due to adverse events. The summary, I guess, the big takeaway is that of the 18 patients who were evaluable for efficacy, the complete remission rate was 50%, with an overall response rate of 66.7%. Of those patients, nearly 40% proceeded to transplant. And if you look specifically at the subset of patients that had high LIL-RB4 expression, and we defined this based on in vitro data, looking at the percentage of LIL-RB4 positive cells, as well as the copy number per cell, 6 out of 18 patients were defined as high expressors. And in those 6 patients, the complete remission rate was 83.3%. 5 out of 6 patients achieved a complete remission, and the overall response rate was 100%. So really encouraging that there may be a biomarker that can select for these patients, but there were responders even in the low LIL-RB4 expressing group. And so certainly more work needs to be done on this. The responses occurred early, with a median time to first response of 1 cycle and a median time to best response of 2.5 cycles, which I think emphasizes that these results are not just due to azacitidine, but due to synergy between IO-202 and azacitidine. The responses have been durable. Patient number one was continuing on study at the time of data cut, 16 months after the initiation of therapy, and no patient thus far has had progressive disease after achieving an initial response. Importantly, responses were seen across all subsets of patients, so both proliferative, dysplastic patients, patients with high blasts, patients with high CPSS molecular scores. And so really exciting data. I think importantly, from a patient perspective, 2 out of 3 patients, or 4 out of 6 patients, 2/3 of patients who were transfusion dependent at baseline became transfusion independent, which of course is huge for a patient's quality of life. And every patient with a symptom score over 15 had a greater than 50% reduction in their symptom score on study. It was really striking to see that the improvement in symptoms were quite rapid, even before any hematologic improvement. So just to summarize, adding this novel drug IO-202 to a backbone of azacitidine resulted in a complete remission rate of 50% and an overall response rate of 66.7%. Again, comparing that to about a 10 to 20% complete remission rate with azacitidine alone. When you look at LILRB4 as a potential biomarker, we can enrich for even higher response rates. The drug seems very safe. Little additive myelosuppression. Responses were seen across various CMML subtypes, high rate of transplantation, high rate of transfusion independence, and a significant reduction in symptom scores. And so these data, in my opinion, strongly support a future pivotal study of IO-202 plus azacitidine in hypomethylating agent naive CMML.